At this hour, nurses are on strike for better working conditions. This all as our state faces a nursing shortage. Joining us this morning to talk more about this is Serena Bumpus, the CEO of the Texas Nurses Association. Good morning, Serena. Thanks for joining us.
Good morning. Thanks for having me.
Yeah, absolutely. So the question is, how did we get here? A nursing shortage?
We have been facing a nursing shortage even before the pandemic hit, and the pandemic has only exacerbated that shortage. We now have our baby boomer generation who is now retiring officially. Many stayed on throughout the pandemic to help, but now they're ready to move on now that we're on the other side of the pandemic. And we also have many nurses who are just unsatisfied with the working conditions that they have and are looking to move away from the bedside, out of the hospitals, into something that provides them with a little more flexibility and work-life balance.
Yeah, Serena, we've been hearing constantly, like you mentioned throughout the pandemic, about this nursing shortage, but really paint the picture. What does this mean for patients? What does this mean when we're showing up to the hospitals?
You know, because nurses are leaving the bedside and choosing other alternatives, or they're choosing to leave the profession altogether, what this means is that our health systems have to stretch nurses beyond what they're already, they've already been stretched to do. And sometimes this could also mean that they're unable to accept additional patients, or they have to cancel procedures and things like that. So, when nurses are stretched beyond what they are capable of doing, this really stresses the system as a whole.
Yeah, absolutely. That's really scary, to have to cancel a procedure. Your organization really works on helping guide the future of nursing and where the profession is going. There were some changes made at the legislative session. Tell us what they are, and are they enough?
So we had several successful bills pass this particular session. One focuses on workplace violence prevention. Workplace violence is something that nurses have experienced for quite some time. It's an epidemic in and of itself within healthcare. And so SB 240 was passed this session that requires healthcare facilities to put violence prevention plans in place. It requires them to have a workplace violence prevention committee, which includes nurses, to have a voice in what those prevention plans and what that policy should look like. In addition, we secured over $106 million to help supply the nursing workforce, to include money towards the nursing shortage reduction program, our nursing innovation grant program, which helps schools of nursing bring in additional faculty to help supply in the faculty shortage that we're also experiencing, which then allows them to increase their enrollment in their schools of nursing. In addition, there's money secured for undergraduate nursing scholarships, as well as loan repayment for those who go into mental health and long-term care.
And tell us a little bit more about what y'all are hoping in order to be able to keep these important nurses in the job.
Retention, it requires all of us in the profession and in healthcare to focus on retention. So we have to ensure that we're looking at our processes and our systems inside our healthcare organizations. There is no healthcare without nurses. And so if we aren't looking at the work that they do every single day to ensure that they are able to sit at the bedside and actually take care of their patients, that will cause nurses to leave. In addition, we just have to be nice to each other. There is still bullying and incivility that takes place within the profession, and that also causes nurses to leave. The workplace violence piece is another aspect of it that have caused nurses to burn out and move on. And so it is not just one person's issue or one discipline's issue, it's everyone's issue.
Okay. Texas Nurses Association is where folks can get a little bit more information. What stuck with me, there is no health care without nurses. All right, well, we appreciate your time this morning. Serena Bumpus with the TexasNurses.org. Texas Nurses Association, thanks so much for joining us this morning.
Thank you.
We'll be right back on Good Day Austin.